Yep. Yep.
They want to put that out there first. Ignore all of that. Go in there and look around without that person. Go into the different wings that you can. Go into the kitchen area and see as much as you can see and see how clean it is. Kind of sit and watch. There usually are chairs and things out in the main lobby part of these places. Just sit and observe and see how things go at the nurses station. That's the best thing to do. Because a lot of times I find that the nurses are carrying on personal conversations that really shouldn't be out loud. I've heard dirty ringtones on the nurses' phones going down the hallways. I've seen nurses carrying pizza and things down the hallway, eating it and talking on the phone. And another thing is they have no communication between nurses and aides. That is a big thing as
Hmm.
far as medication care overall.
You talked about earlier the nurses and the name tags. Apparently, the RNs and the aides and the charge nurses, it's rather important, really, to know who they are by name in order to get more done.
Yes, because if you address someone by name, I guarantee you that you're going to get more done. That's another reason that I stress. If you see somebody without a name tag, ask them, "Where's your name tag? What is your name, by the way?" I have a bad memory myself, so I have to either write it down or I have to see a name tag, especially from as many people as you're going to come across in one of these facilities. You need to know who they are at a glance,
Mm-hmm. Mm-hmm.
and the only way to do it is a name tag.
Absolutely. You mentioned the kitchen earlier, and I think it's important that sometimes that you talk to the kitchen just about your loved one's special diet, particularly if they have special meals that need to be prepared in a certain way.
Yes, my dad, I'll use him as an example. He has to have more than pureed food. He basically has to drink it now. Go straight to either the charge nurse or the caseworker for the facility or straight to the kitchen itself and tell them, I will bring the food if they will let you do this. Some facilities will not. If they will let you bring the food, like I bring my dad's, and then they get it ready, you need to tell them that it needs to be more than pureed. It needs to be more like soup. Maybe put in a smoothie blender. You need to get really specific with them because if you do not, they will just push the tray in the room and leave it, or they will go in there and sit down and give them a few bites on a spoon and say, "Are you full?" and then walk out. Their job is done. So the only way that I could get my dad to eat was have a meeting with the ladies in the kitchen,
Mm-hmm.
explain the backstory,
Mm-hmm.
and now he's eating fine. They bring everything in there in one of the water pitchers, like you see at the hospitals, with a flex straw sticking out the top of it. And he drinks his meals, and he's doing much better.
Mm-hmm.
But as far, let me go back a little bit to the backstory. It
Mm-hmm.
always helps to give everybody, aides, nurses, charge nurse, administrator, everybody the backstory. Here's why.
Mm-hmm.
They did not know my dad's backstory. They thought that he looked like that, which is not able to walk, almost incapacitated, in a lot of pain. He thought he had all. They thought he had always been that way.
Mm.
The thing is, he was completely living independent, doing laundry the day of the fall. Since they thought he was like that all the time, they had put him on what's known as palliative care, which is just a step above hospice care.
Mm-hmm.
They
Mm-hmm.
just make them comfortable.
Mm-hmm. Mm-hmm.
Well,
Mm-hmm.
remember the heel
Yep.
ulcers?
Mm-hmm.
They were not treating that, and this is something else that I'm not sure that this is right. The nurse practitioner that I talked to said, I thought he was on palliative care. I said, no, ma'am, that's not right. I don't know where that comes from. He is trying to get back home from here. That's why he's in the skilled unit. Well, since they found out he's not on palliative care, that's a completely different treatment plan. So we'll get a mattress in there that relieves the pressure. We will x-ray that since it's been on there 3 months and do this, that, and telling me I need to sign off on it, and I agreed to all of that. But what gets me is so if he was on palliative care, they were
Uh-huh.
just going to let him lay there and not treat this wound and let it get to the bone and then let there be an amputation and let he become septic and
That's what it sounds like.
it's like that's like it shouldn't be that way is all I can say. Make for sure that you know
Yeah.
what kind of treatment plan they have for your loved one.
Hmm. Another issue that patients face in there is the response time on the call buttons. And how long can that take sometimes before they actually get somebody to their room?
I've timed it, which you very well have the right to do that. Sit in the room, press the button if the button's working,
Uh huh.
and time it and see how long. I have timed 35 minutes
Hmm.
before a response happened on the weekend.
Wow.
Usually during the week, it's about 15 to 20 minutes during the week on an average between all of these facilities here. Well, just think about that.
Yeah.
If they really need to go to the restroom, they're going to wait 30 minutes before they get to go after they realize they need to go.
Hmm.
So
Hmm.
that's not good enough. That's
Hmm.
not acceptable.
No. Some of them can't wait that long, depending on their health condition.
Exactly.
You talked earlier about some of the nurses and nursing aides, and that you had personally heard and witnessed them making personal calls, the ringtones while on duty, and that it's important that kin folks pay attention to what you hear and what goes on there in the facility.
Yes, because word of mouth is sometimes the best way to find out what goes on behind the scenes. Because I've had other people in a facility basically pull me off to the side and say, hey, they're not treating your mom or your dad right, and I'm just letting you know you need to be more present, and this is the time you need to be present. You're very lucky if someone will do that. I
Uh,
literally had a nurse call me and talk to me a whole hour when they sent my mom off for the mental evaluation and sent her back basically comatose. And she explained that situation and she said it did not go correctly with your mom. You need to look into it. Well, this is a side note. I did. I thought, okay, just in her honor, I'm going to try to make a big deal out of this.
Good.
So I called 3 different attorneys, and I finally got one attorney that told me something that left my mouth open.
Uh huh.
And I know I'm not going to get these numbers and these ages exactly right, but basically, this is what she said. She said, if you are of the age between 5 to 1 or unborn, there is no value to your life as far as a lawyer's concerned, and they don't want to fool with it. Or if you're 65 or 75 and older, there is no value to your life in the eyes of an attorney or a lawyer, and they don't want to fool with it.
That's alarming.
That's the way it is as far as lawyers and attorneys see it. They don't get enough out of it to fool with it because of the ages of the person.
Wow.
That
Wow.
one just kind of left me floored when she said that.
Wow. Another very, very concerning issue is in some facilities, the employees may actually be using handicap parking spaces. How in the world did they get away with that?
Right now, at the facility that my dad is in, every day that I've been there, and I have an extremely bad back myself, and I like to take advantage of my placard as much as I can when I go to these places.
Well, sure.
There has been an automobile parked backwards in the physical handicap. parking spot every time I've visited my dad. This car has a sun blind in the windshield with big eyelashes on it. It has a rhinestone wheel cover on it, no physical handicap plates, no placard, specialized hubcaps. It just doesn't look like it belongs to somebody that's handicapped. Now, I know you can't always tell
Uh
by
huh.
that, but I'm really close to just asking about that car
It might be worth reporting.
because I think one of the employees is taking advantage of it. So if you
Absolutely.
don't see a physical handicap placard or a tag or something in a vehicle that's close to the front doors of any of these facilities, you might want to ask about it.
Sure. Absolutely.
And that's just my own personal thing. I don't think that's right for that to be that way.
Absolutely. You talk about attitudes in there sometimes, passing the buck to the aides. We deserve breaks, you know. Tell me a little about that situation.
I walked into the facility that my dad was in on a Sunday afternoon. I let myself in the front door. I went from the front door all the way to his room, which is not a short distance.
Uh huh.
I entered the room and I found him laying there with no clothes on, with no clothes in the room, keeping in mind that my dad has no dementia.
Mm
And he was yelling and screaming, saying, I'm burning on the inside, and there's nobody here to help me. The nurse's button was on the wall. I saw no human beings from that front door to his room down that hallway, so I went back down the hallway to get somebody at the nurse's station. Still, out of 4 or 5 hallways, a nurse's station, and a front lobby, no one was visible. So I went back in there and I done the best I could with him. He was laying his own feces, his own urine, and just out of his head.
hmm. That's just blatant neglect there.
Yes. So I went to the nurse's station and I run into 2 of these registered nurses, that were not very friendly, let's put it that way. One of them looked at me and said, well, you know, we are entitled to breaks. We do get those every once in a while. She's probably on break because I was asking where my dad's nurse was or the nurse for that hallway. That's what I got. Attitude. And the other lady didn't seem to know much about any of it. She grabbed one of the laptops there and she started looking for information, and she told me that he had put on um, a mood stabilizer drug. And I said, well, that shouldn't have happened because I specifically said I didn't want him on anything like that. If I knew about it, maybe, but if I didn't know about it, no. And I said, he doesn't have dementia. And she said, oh, yes, he does. And I looked at her like, lady, uh, really? I said, I've known him for like 88 years, and you've known him for a week, and he does not. And she said, yes, I've worked with him down there. And he likes to take his clothes off. My daddy has never done that. He had an attendant that stayed with him 5 hours a day at the house before the fall. Never tried to do anything like that. She just blatantly made that stuff up.
Mm hmm. Mm hmm.
And I told her, I said, well, we need to do something. I think he's had a stroke down there. Where is his nurse? So I ended up calling one of the supervisors or one of the higher ups. And I said, I want him transported out of here to the hospital to see if he's had a stroke. Well, there was an aide that finally came down the hallway because of all the noise, and she brought some clothes and she helped me get him dressed. The paramedics came and they took him. But let me back up and explain why and what happened.
Mm hmm.
The first week that he was in this facility, it was 5 days before they caught that he hadn't had a bowel movement.
Oh my goodness.
They have a system set up in place to where they know every 3 days whether they're having bowel movement or not, and they're supposed to key it in and watch that between the aides and the nurses.
Mm
There
hmm.
should be communication for stuff like that. There's
Yes.
not. So fast forward, That last visit, when I found him in that condition, he had gotten so impacted that he was just going out of his head because it was getting into his bloodstream.
Oh, the
It was backing
toxicity. Yeah,
up.
toxic. Yeah.
He was toxic. So he went to the hospital, and 4 weeks later, after having to be manually cleaned out, almost a surgery involved, many treatments to get him completely cleaned out. That's when I transferred him to the other facility from that one.
I don't blame you.
And that is just neglect. So
Absolutely.
here again, be as present as possible. Watch for things like that yourself, because don't ever assume that they're doing all of this. Just assume they're not doing it is the best way to look at it. When you go into the room, do an assessment yourself. Check the nurse's button to see where it's at. Check the diaper. Check the bed. Check to see if there's a urinal bottle in there. Check to see when the last time someone's been in the room to check on them.
Well, what about if you feel something is wrong? Maybe even putting a camera in your loved one's room, and Wi-Fi signal, either facilities Wi-Fi signal or whatever. What do you think about that?
The facilities, some of the facilities, I should say, will let you put a camera in your loved one's room to keep an eye on them. And I did that with my mom when she was in the dementia wing, because she kept telling me so many things that I wasn't sure whether it was just her dementia talking or they were actually doing it.
Uh huh.
So I put a camera in, and then they have to post all these papers on the outside of the wall there that says there's a camera in use. They make for sure that everybody knows there's a camera in that room.
Mm-hmm.
So then they started pulling the blinds where I couldn't see what was going on between the camera and her. I even had one nurse that turned it
Mm.
away because it can save a life. Because at one point, my mom had gotten her blouse up around her neck and she was hanging from the bedpost.
Ouch! Wow.
And I saw it on the camera because it was motion sensitive. I called the nurse. They didn't know any of this was going on because their door was shut. So sometimes the camera is really good, but they will not allow it to be there long if you worry them to death with it. I'm just being honest. They told me that I couldn't use the guest Wi-Fi signal anymore to operate the camera, that I would have to install my own Wi-Fi system to use the camera. They were trying to make it as difficult as possible for the camera to be there, hoping that I would just take it out.
Mm-hmm.
Something else I saw on the camera, I believe is in a little bit farther in there, but I'll go ahead and start with it now. In the dementia halls,
Okay.
they allow it to be male and female patients together.
Mm-hmm. Mm-hmm.
I don't think that needs to be that way. That's just my opinion, but here's why I formed that opinion.
Yeah.
I was watching on the camera. There was an elderly man that also had dementia, came into my mom's room
Mm-hmm. Mm-hmm.
and was watching her sleep. He went through her underwear drawer.
Wow.
He was standing there watching her, and
Wow.
he was masturbating.
Oh my
I
gosh.
yelled at him through the camera. At that point, they told me that I would have to move my camera because I spoke out to a patient and told them what to do. So you make of it, that situation, what you will.
It sounds like they're covering themselves as well as they can.
Yes.
It's terrible.
So put a camera in. If you can afford to put a camera in, make sure and put your own Wi-Fi signal set up with it so they
Yep.
can't use that excuse to get it out of there. Make
Right.
sure and position it somewhere high that the nurses can't change it.
Right.
And possibly if there's a curtain, put it to where the curtain can't be drawn between you and them.
Absolutely. Okay, talk about dumping a patient. How and why would that type of thing happen?
Google, and do your research, people.
Yep.
Look up dumping elderly patients. What that is short of it, if they have so much trouble out of a patient, they will send them off for either a mental evaluation or for a test at a hospital. and then they will refuse to take them back. That's called dumping. Most places will hold a room for a certain amount of time. That's not the same thing. Dumping is when they want to get rid of them and they send them off for a test and then they refuse to take them back for this, that, or the other reason.
Mm-hmm.
They tried to do that to my mom. And since I had done my research before they sent her for a test at the hospital, I said, now, I know you're saying she's causing a lot of problems. You're not going to dump her, are you? You should have seen the look on their faces because I had done my research and I knew what dumping was. Oh, no, we wouldn't do something like that. She'll certainly be welcome when she comes back. But they were planning on doing it.
Wow, and you got them red-handed. Talking about Googling, I think reviews are very important. That maybe problem areas, if you see problems, maybe 9 times out of 10, the facility has something wrong there. Tell us a little about that.
Always, always, always. And this is just not for nursing homes. This is anything. Check the reviews of every business that you deal with. Believe me, those reviews are more right than they are just disgruntled customers and family members. Because if somebody takes the time to leave a review about something, generally there's something wrong.
Right, right, absolutely.
So read those reviews and see how recent the reviews are. See if the person or people that's mentioned in the review are still there. Meet them for yourself. But yes, look at the reviews on each facility and see what they say.
Here's a quote: "When a nurse loses her heart, it might be time to retire." How bad and how prevalent is that in our nursing homes?
I, I see it a lot now that I've had to do this twice with my mom, now my dad.
Yeah, yeah.
My primary care,
Primary care.
dad's primary care doctor,
Uh huh.
nurse, been a nurse for many years, said when a nurse loses her heart, it might be time to retire. I didn't fully understand what she meant by that statement, but I see it now. When they go to collect a check or they're just there and they're burnout
Mm-hmm.
and they don't really care for the patient anymore, it's just another body there in the bed, it might be time to say something to somebody higher up and say, hey, this nurse or nurses, like for instance the two that I run in at the nurses station with the attitude and everything,
Yeah,
it might be time that they retire because it
yeah,
actually they look like they might be working over retirement age, and I get that too. I understand where sometimes you have to make ends meet,
yeah.
but when it comes to health matters and treating your loved ones with care, you should treat them, everyone in the facility should treat them as they are their own personal family member.
I think it might be important that people find a place that believes each patient should be treated as if they were a family member.
That's
Don't you think
exactly
that's
right. That should be the mentality of the facility, or just move on down the road to the next one.
well? People, you've heard it all here. These are all actual, true accounts, actual events that took place. Consider all of this whenever you're putting a loved one in a nursing home. Now you know the rest of the story about the nursing home nightmares that are happening nationwide and how you could be personally affected or your loved one. So, thank you very much for listening. Please give this a like. Please share it. Please let other people know that this is going on in our great nation right now. Thank you very much. This is Rich Vernado.